So if you've just started carnivore and you're starting to experience some of the side effects that this person is experiencing, like low back pain, heart palpitations, dizziness, headaches, let's talk about why you might be experiencing some of those things. And I always tell you to, if you're very concerned, check in with your medical doctor. When you are moving to a carnivore diet, you are removing carbohydrates from your diet, and with that comes a loss of water. So we stop holding on to as much water, and when the water is flushed from the body, it often flushes out our electrolytes, potassium, sodium, and magnesium. So this could result in you feeling like you have muscle weakness, maybe a little bit of dizziness, nausea sometimes. These are all normal symptoms of electrolyte dismanagement. Is that a word? Electrolyte unmanagement? Okay, I'm not going to dwell on that. I've been on calls all day. So this is a symptom of not having your electrolytes managed well. So definitely use electrolytes like Relight or LMNT. Definitely salt your foods as well. When I first started carnivore, I went through like a month or two of just intermittent heart palpitations. I'd be laying down and I'd kind of just feel my heart catch up. And I definitely had to do a little bit of listening to my body and increasing my electrolytes, and it resolved. The other thing is when you're increasing the amount of protein that you're getting, so many people are under eating. And then when you start carnivore, you tend to get right into protein. So your kidneys need to take some time to adapt, which they do. This is not a problem for your kidneys. They just need to adapt. And so sometimes your low back, that pain that you're feeling in your low back or that achiness is just your kidneys having to catch up. So what you want to do is still make sure that you're hydrating to support your kidneys. Remember that your body has been living off of glucose, living off of the sugar that you've been eating in your diet. So make sure that you give your body time. Your body is literally just adjusting to getting better at using fat for fuel. It's like if you just all of a sudden changed, I don't know, this is a really bad example, but it's like all of a sudden putting diesel in your car instead of unleaded. Your car, obviously, it's not going to run well, so it's a bad example, but you need some time to adapt, and your body just needs time to get used to using fat for fuel. So just give yourself a little bit of time. As always, make sure that you're eating really good, healthy fats. So don't just go super high protein, add the fats in a 1-to-1 ratio when you start. So 1 gram of protein for 1 gram of fat. And so what you want to do is make sure that you're giving your body the fuel that it needs. Always, always, always go for fatty animal meats first, and butter and tallow are great options as well. I always give bone broth as an example of something to use with actually a lot of symptoms of easing into the carnivore diet. And so if you're still feeling off, definitely sip on some bone broth. It is packed with nutrients and electrolytes, and it will help ease some of these symptoms. The good news is a lot of these symptoms go away with time as your body adapts and becomes fat adapted. So just stay consistent, stay hydrated, and as always, be sure to listen to your body. As always, make sure that you follow me for more carnivore advice. Ask questions in the comments. I'm always willing to help. I also have an 8-week program that is starting this week, and I'm introducing a ton of new members the past couple days. And it's a really great way for you to jump right in and get all the resources that you need. I just got off of a few coaching calls for it, and these women are getting set up with their macros and calories, and it's for women and men. But come on in and join us because it is a great community so far, and it is definitely a way for you to stay consistent throughout the holiday season.